So keep that in mind. That's very important to still do. If you have a laser, continue to like use it in addition with your laser during treatment. Same with air powder polishers. It's just going to make it so we can be better at our jobs and do better for our patients, right? So that's where I see this going, is really improving the long-term oral health of our patients. My patients who are in mobile settings, like I have this one patient who just can't brush his teeth and nobody helps him. He attempts to do it. There's nobody really like doing a good job for him. I use it on him and like the first time, and I was like, I hope that this helps. And like I go see him every 3 months, and compared to that first time, I'm like, it could be that I'm brushing his teeth more often, like encouraging him, my motivational interviewing. It could be a little bit of that, but I also think a little bit of that is the perio-DT, keeping that biofilm low for longer. So I'm really grateful for that for the future to help reduce that inflammatory burden for our patients' overall health. Also, when we instrument, we introduce bacteria into the bloodstream. That bacteria goes all over the place, right? We know that it goes to the brain. We know that it goes to other organs. And so if we can place it procedurally, desiccate that bacteria and biofilm before we introduce it into the bloodstream, like patients with systemic health problems, that's going to make a big difference in their inflammation, right? Also, aerosols. If we place this before we desiccate the biofilm, it's going to reduce the bacteria in our aerosols logically, right? There's been no like studies on this, but that's where I'm thinking the future is going. I also use it a little bit off-label for aphthous ulcers. If you put it on an aphthous ulcer, you put it right on, it stings for about 5 to 10 seconds, rinse it off for your patient, cauterizes that tissue. As we know, it cauterizes in the pocket and reduces that necrotic tissue. It creates great relief for your patients. So if they're coming in and they're like, don't touch this area, it's so painful, like you can just, I have a syringe in my drawer that's not for a particular patient, but I will get some out in a Dappen dish. I'll grab it with a little brush and apply it on. So you could do something like that. That's totally off label. So keep that in mind.